Hello, I'm Janice Karen, Director of Policy, Technology, and Innovation at the Massachusetts Health Data Consortium, or MHDC. I run our Data Governance Collaborative, also known as the DGC. We start each of our weekly meetings with a series of industry quick updates to learn about new and proposed regulations, laws, standards, industry initiatives, and other activity. Join us for this week's updates. And if you'll go ahead and move to the first update. We're going to start with some security related stuff. First, there have been two reports to Congress. This is the first one related to HIPAA compliance and breaches. So this particular one basically gave data on breaches that happened in 2021. Interestingly, large breaches were actually down 7%. There were still 37 million people affected, so it's not like it was nothing. That's still about 10% of a little bit more than 10% of the US population. And hacking was the most common breach type for these large breaches. There were quite a few more smaller breaches that affected less than 500 people. But you'll see that a lot of these probably affected 1 or 2 people, and on average is a little bit under 5. And the most common thing here was unauthorized access. They basically, the main takeaway from the report was a very generic statement that regulated entities need to continue improving their HIPAA compliance, particularly paying more attention to the security role. Any questions or comments about this? You can find the full report at that link. Let's go on to the next one, which is actually HIPAA compliance. So this is sort of the sister report, also for 2021. And here what they found was that there was a significant increase in the number of HIPAA complaints that they were getting. And in fact, just from 2020 to 2021, there was a 25% increase. Of those complaints, 78% were resolved without any investigation. 16% resulted in technical assistance. So you can see there's a very small percentage that resulted in anything significant. And in fact, 3% required corrective actions. There was also a significant increase in large breaches, 58% over the 4-year period that they looked at. They also talked about compliance reviews. So they did 573 compliance reviews, and 83% required corrective action, 11% found insufficient evidence of a violation. Obviously, there were a couple of other smaller, I think there were 2 other possible outcomes that had 3% each that were not consequential. You can find the report at this link, and anyone want to comment or say anything about this? All right, moving on. So this is, CISA has put out via a new blog post some guidance on individual protection from cyber attacks. It's quite basic. All of it are kind of no-brainer things, but it's kind of nice to have everything in one place. And it's sort of a list of paragraphs. So they list specific items, and they kind of have basic and then next level, although they're all pretty much on the basic side. And just, really basic stuff. Don't click on links or open attachments. Don't give out your personal information via email or phone without knowing who's on the other end. Use good passwords, don't share them. The one that maybe is something that a lot of people don't do that you could consider is the verifying email request for information by calling the company directly. And that may seem like overkill, and it may be for certain things, but if it's something where they're requesting information and it makes you in any way uncomfortable, that's really the best action. Now, obviously, that gets harder and harder these days, as there are quite a few companies that don't allow you to call them anymore. But in general, if that's an option, that's a good option to take. So you can find the entire blog post there. And again, there's nothing revolutionary or really unexpected there, but it is kind of nice seeing them kind of all laid out in one place. Any comments or thoughts there? All right, let's move on then. Moving on to the ONC portion. ONC has opened the SFAP comment period. Just to refresh your memories, SFAP is the process of optionally advancing standards. So you can basically comment here that says, this standard, I'd like to see this standard move to this version. I'd like to be able to use this standard and give some rationale. They'll take all those comments and sort of look at them and make some decisions about what they want to allow. For instance, last year, last year they optionally added support for US CDI version 2. So the regulations all require version 1. For ONC certification, you can optionally certify against version 2 instead if you wish as a technology vendor. They're also accepting some comments on the process of SFAP if you have any, and this is open through May 22nd. So they talk about it a bit in this blog post, but anyone have any questions about either what SFAP is or the types of things you might want to comment on? All right, moving on. ONC has published a new SDOH information exchange toolkit. I've noticed that sometimes in healthcare, when people say toolkit, they don't mean what I mean by that word. So I wanted to clarify that this is kind of a guidance document that talks about how to do SDOH work from a variety of different angles, both technical and non-technical operations, workflows, stuff like that. And as you can see, they kind of have 10 foundational elements that they talk about. And they're kind of grouped together in groups. So I listed all 10 here in groups. And so as you can see, there's sort of a top level sort of what our mission is, what our values are type stuff. And then there's a set of kind of policy and legal. It was interesting to me that they put measurement and evaluation in this group of stuff, because I would have put it in the next group myself. But they did group it with, they grouped measurement and evaluation with policy, legal, and financing. So that maybe it's deciding what you want to measure, but even so, the next level down was implementation, technical infrastructure, and data standards, and then user support and education. And they kind of had governance at the bottom, but kind of touching on several of them. So sort of touching on those other, everything that's in the bottom 2 bits kind of. So that's kind of, you can find the blog piece with a link to the full toolkit there. And I have not read the entire toolkit. I haven't looked at the entire document yet. I haven't had a chance, but basically I would look at it again as more of a sort of a guidance document. And like, these are some things you can consider while you're looking at these steps of putting together a program. Any questions or comments there? No. All right, let's move on. So ONC also put, this is interesting because this is kind of unusual. They just published yesterday a new blog post about the CMS interoperability and prior authorization rule, excuse me, as well as another rule related to Medicare pricing. And there isn't really anything earth-shattering. I think they were just sort of in a lot of ways, they were pointing out some of what's in the rule, but they are kind of reinforcing that they want to work hand in hand with CMS. And they do reference the RFI that they put out about a year ago, and that they may take, they don't promise anything, but they kind of hint that once the CMS rule is finalized, they may, there may be some corresponding changes that come out of the RFI and that rule, but that's even too strong. They don't even really go that far. You can kind of read that into what they say if you were inclined to read that into what they say, but they don't even go so far as to really strongly imply it. And again, one of the things they're doing too is sort of promoting the ONC role in the CMS rule by saying they're using our standards and to keep everything in sync. So you can find the post there. Again, nothing earth-shattering or earth-shaking, but I did think it was kind of interesting that they chose to make it. Any comments or thoughts there? All right, moving on. All right, so here's another interesting one. The FTC has created a new Office of Technology, and you may remember that the FTC oversees, from the standpoint of health stuff, third-party apps, and anything, once stuff leaves HIPAA, the oversight of privacy goes to the FTC. So this is increasingly more relevant in the healthcare space, and they have a new Office of Technology. They're meant to basically strengthen enforcement and investigation abilities, and advise on policy and research initiatives. So for instance, they had that really great RFI last year where they talked about the data surveillance state and what could be done to improve privacy and commercial actions around data. And presumably this group would be part of any actions that come out of that RFI. And then also to look at market trends and emerging technologies. So have some, engage with stakeholders, do public presentations, highlight best practices, stuff like that. So I thought this was an interesting step, probably a good step. I don't think it's actually I don't think they're doing anything they didn't do before. I think they're just sort of formalizing it and centralizing it into one location. I don't know if anyone else has a different take on that or any thoughts on this. All right, then let's move on. So another report, there's a Congressional Research Service that does research for Congress, as you might infer from their name. And they just did a report on telehealth coverage under private insurance. It's mainly looking at some of the flexibilities that were put in place during the public health emergency, and then taking a look at the state of telehealth post-public health emergency with some very general recommendations. Again, I thought they could have made a little bit more specific recommendations. But it does provide one of the things it does that's interesting is it provides some statistics on employer-supplied telehealth benefits. And it implies, without explicitly stating, that they're actually talking about telehealth outside of the traditional healthcare system. So for instance, like direct support for telehealth apps, perhaps buying a subscription to a telehealth service outside of the normal insurance process, stuff like that. It's not clear if their statistics include telehealth support within a more traditional employer-based insurance setup. The recommendations to Congress, like I said, were very vague. They basically suggest that Congress consider whether any of the flexibility should be retained. Well, gee, that's a shocking recommendation, kind of a no-brainer, and already happening for the most part. And it also talks about how it mentions some of the bills that they tried to get passed last session that didn't pass, and including one that allowed for telehealth only insurance plans. And so they didn't specify whether they were for or against those. They were just kind of noted in passing. So it does have some interesting stuff, but it was a little bit of a frustrating report because it was kind of vague and didn't make any strong recommendations or have anything terribly exciting or unexpected in it. But you can find the report there if you're interested. Anyone else want to comment on any of that? All right, then let's move on. So CMS has opened up applications for what they call the bundled payments for care improvement model. It was supposed to end in 2023, but they're extending it for 2 more years. Excuse me, my apologies. So the applications will close at the end of May. This is kind of an interesting value-based care setup because it's episode-based, and you basically sign up for certain service lines, and there's 8 of them. And then the program gets initiated based on the claims, submission of claims for one of the triggering events. And those triggering events can either be an inpatient stay of a specific type or a specific qualifying procedure. And then the event lasts for 90 days thereafter. And all of the claims are sent to Medicare fee-for-service, and then the clinical episodes are reconciled every 6 months. So it's kind of an interesting model. And I don't know, Denny, did you join? I know you know a lot more about the different value-based care setups than I do. Is this something that you've seen a lot of? Because I haven't.
Well, the bundled payment program has had a number of components to it, whether it's for specific services like a bundled payment for musculoskeletal procedures, which include, the procedure itself, pre-acute care, like pre-rehab, procedure rehab, post-acute, that usually go for 90 days post the procedure. Some of these have proven more successful than others. Others have, I think the bundled payment for care improvement model is being extended because they're seeing that post-COVID, and this is my reading between the tea leaves, they don't make their reasoning entirely clear on this, but post-COVID, more and more providers are looking at these initiatives as moving them away from pure fee-for-service and toward stronger risk-based contracts that carry some benefits, irrespective of whether the services are delivered or not. Bundled payments fall somewhere in the middle, but physicians and providers have done well with them when they have implemented them well. And the care improvement model is probably one where this administration also wants to see that, along with better financial performance, CMS is seeing, or the Center for Medicare and Medicaid Innovation is seeing that there is indeed an improvement in clinical quality. So
yes. So is it
that's
normal?
as best as I understand it.
Oh, I'm sorry, Dan, I didn't mean to interrupt you. Is it normal?
That's quite all right.
For the claims to be sent in normally through fee-for-service and then be reconciled afterwards? Because that's the part that I don't think I've seen before.
That I haven't seen before either, Janice, and I'm not sure if that is something that is done in other bundled payment models or not. Medicare has a big fee-for-service infrastructure, and to the extent that they have the wherewithal and the infrastructure to support bundled payments on their own, without pushing them through their fee-for-service environment, their fee-for-service chassis, I don't know, but it seems to me that this would be more a matter of necessity rather than a preference of Medicare's. It strikes me.
Gotcha.
But we'll see.
Thank you for illuminating that. Any other thoughts or comments?
Yeah,
go
question,
ahead.
Janice.
Sure.
Was this specifically looking at Medicare and Medicaid, or was it bigger than that?
So this particular program is specific to Medicare.
Okay.
Yeah,
because of course in commercial insurance, bundled payments occur all over the place. That's one of the things that HMOs do in negotiating fee schedules with their provider network.
Yeah, the part that, like I was saying, the part that I found interesting was that the processing happened through normal fee-for-service claims and then got reconciled later. And that was the part that I hadn't seen before, but I don't know that I probably saw more information about this particular model than I've seen about most, because I actually looked at paperwork as opposed to hearing someone talk about the highlights of it.
Yeah, and that is probably because of what Denny was alluding to.
Yep.
that their systems are just not set up to bundle a payment at the time claims are received.
Yep, no, that totally makes sense. All right, if there's nothing else, we'll move on to the next thing. All right, so also just this is just a FYI. CMS has put up a page where they're trying to pull together all of the different guidance about the end of the public health emergency. There's not a ton of information there. It's mostly links to other things. And the one thing that it does do is it kind of has a list of all the areas where waivers have been in place. So you can at least look at that and see if there's something that you want to try to investigate what's happening when the public health emergency ends. So you can find that page here. And again, there's not a ton there, but my feeling is that there will be stuff added to that page as time goes on. So let's go ahead and move on from there. So this is kind of a bouncing ball situation. Probably took about 2 weeks, maybe 3, to partially resume the no surprises IDR process. When they froze the IDR process, just the determination portion, a couple weeks ago, they froze it basically as of the date that the court decision was made that caused them to freeze it. What they've done here is they've been able to retroactively say that if the items and services under dispute were furnished prior to October 25th, 2022, we can go forward. But everything from October 25th on is still within this period that's under the court's purview. And we have to pause there pending figuring out how to deal with the court decisions. And again, as was the case with some of the previous information, I got this via email. I have not seen anything about this on the website. But they basically sent out a direct email to everyone who's subscribed to IDR information indicating this. Any comments or thoughts or questions? All right, then let's move on to the next one. So this is another one of those informational things. And I thought this was interesting because they talk a bit about what it takes to have a successful cloud strategy, but they also do it using a different government agency example for each type of component. So they would look at the agency that they thought did planning really well and talk about what they did for planning and some of the things that people might consider. They looked at a different agency for testing, a different one for security, etc. And they looked at each of these and they looked at, it was also kind of a 360 view. They didn't just look at the technology, they looked at personnel, they looked at processes, they looked at the role of data and analytics in creating a successful strategy. So it was a really interesting read. There's this really good article, and then that article has a link to the actual report. So I recommend it for those of you who are interested in cloud services or just sort of general security and planning of IT projects. Any comments, thoughts, questions there? All right. Next slide, please. I believe this is the last one. This one was interesting. So Department of Homeland Security did a pilot test looking at various facial recognition algorithms for 11 days. And I think they basically simulated an airport situation. And one of the things that was really interesting was the finding around skin tone. And they found that there was a variety that the cameras themselves that they were using to take the pictures to do the facial recognition had problems with light skin and dark skin, and performed best at medium skin tones. And they took a look at it and determined that the cameras weren't able to adjust to different photon reflection rates. And that cameras need to be more configurable. So one of the things that they were looking for from the AI algorithms was the ability to make adjustments to the cameras. But they had discovered this as a basic problem a while ago, so there'd already been some improvements, but they aren't configurable enough so that they can be modified to match and take good pictures of people of all skin tones. So it was a really interesting thing because they had previously identified the problem. They'd made some efforts at addressing it, but they still hadn't adjusted, and they were able to determine in this particular study there had been they hadn't done it in a way necessarily that identified what the exact problem was, and they did with this one. So it's a very interesting read. Recommended to everyone. Any comments or thoughts or questions there? All right, if you'll move on to the next slide and stop there for one moment. I hope you learned a lot from our quick updates. If you're interested in finding out more about the DGC and its other activities, email me at dgc@myhealthdata.org. That email address is also on your screen. Thank you very much, and we hope to see you next week.